Good morning, all. Thank you for being here today. We are so very appreciative of your time. Today is May 23rd, 2023, for today's technical assistance training featuring Bridging the Health Literacy Gap from Eddie Wiley. And without further ado, I'll do kind of like a brief introduction to Eddie, and then the floor will be his. So, Eddie Wiley has worked to combat HIV stigma and health disparities in Black communities since 2006. As a presenter at local and national conferences, he has been able to speak of his experiences as a person living with HIV in addition to being a service provider. Mr. Wiley currently works as a consultant with JSI and a podcast host while still finding time to fuel his TikTok addiction. He has been featured in Ebony, the Unleashed Voice, Positively Aware, and Pause magazine. Eddie plans to continue his work in the Mid-South region in anticipation of one day ending the HIV epidemic. And before I give the mic over to Eddie, I will just go ahead and do kind of like a courtesy. If you are not presenting, just please make sure that you are on mute and your camera is off, so that way we can preserve the bandwidth as much as possible while Eddie is presenting. And other than that, the floor is yours.
Awesome. Thank you. Thank you. Thank you. And can you all hear me good? Thumbs up. Think so. Okay. Well, good morning. Good morning. And thank you for joining me today for Bridging the Health Literacy Gap. Today, we'll be talking a lot about health literacy. I'm going to wear you out with that term. You're probably going to get tired of hearing health literacy by the time we get done with this presentation. But I promise you, you will leave with some nugget. Even if it's a little nugget, you'll leave with something. Let's see. So, as Elizabeth mentioned, my name is Eddie Wiley. Some of you know me, some of you may not. I'm a native Arkansan with the love for community. I started my career in public health as an intervention participant. And throughout the years, I've held several jobs. My first real job was a case manager with Our Care in Little Rock, Arkansas. Then I transitioned to the community HIV network with LeBonner. Left there, joined Friends for Life for a hot little second. It didn't last long, but I did appreciate all of the insight that I gained. After I left Friends for Life, I joined John Snow as the online community manager for HIV.gov. I did that for about 2 years in Atlanta, came back home to serve as the coordinator for Tennessee Department of Health for EndHIV901, left TDH, and now I'm back at JSI as a consultant. So my current work as a consultant spans from technical assistance with planning councils. I'm also on the EHE, the federal side of EHE now. There's behavioral change, and I even do work for Elevate with NMAC, which was just in Memphis maybe last week, I think. And that's just my 9 to 5. So that's just 9 to 5 work. As Elizabeth mentioned, I am a huge TikTok addict. I also host the EAC Speaks podcast for engaging Arkansas communities. And I also have my own show, so you can find that as well. I do drag, host events, a little burlesque, and doggone there anything that comes with a good coin. So now that you know a little bit about me, I want to know a little bit more about you. So as you can see on the slide, I want you to tell me in the chat, tell me your name and which Whitney Houston meme most connects with your mood today. It can be one, it can be a combo, it can be neither, it can be all of them. So in the chat, tell me which number do you most associate with today? Be monitoring the chat. Elizabeth says 6. Okay, I'm looking at them. 7, I see a few 8s, a couple of 8s. I think I'm right there with who was that? I'm with you, Allie. I'm at a number 7 today. But we're gonna make this thing work. I appreciate y'all for jumping in with my fun little emoji meme obsession. So I always like to start my trainings with a few group agreements. Oh, you couldn't see the memes. Let me see. Is it my participant thingy here? Could be, because there we go. I have to minimize myself. There are 9 of them actually. Okay, Lila's number 6. Okay, so some people could see him. Anyway, we're moving on. Like I said, I want to start with some group agreements. It's not a comprehensive list by any means, but I do want to make sure that we have agreements that go for both me and you. So today we are both going to be tackling health literacy issues, specifically in the Mid-South. I would appreciate it if we could all agree to be present. I know it's virtual. You're probably handling a million other things in the background, but do your best to be present. You never know when I'm going to pop in with a quiz. I'm just playing. I don't like quizzes. Those get on my nerves. But in the same tongue of being present, I'd like for you to take care of yourselves. So if you need a bio break, somebody comes knocking at your door, maybe breakfast is done, do what you need to do to take care of yourself. Now, this is for my folks that like to tussle, okay? Someone might have a differing opinion than us or a different experience from us. So let's do our best to remain curious, open, and respectful. And then we also know that somebody may share a private moment that they may not want to be shared outside of this space. But let's do our best to maintain confidentiality by not sharing personal health information, of course, people's information as well. So use your best judgment on that. And then don't hesitate to ask a question. None of us should be above a learning moment, which includes me. So don't be afraid to ask if you do need a question, if you do have a question. So just as a precursor, I absolutely love memes and gifs. You saw Whitney. So don't be afraid when you see them. And especially for today's session, you're going to see Maura Rose from Schitt's Creek. If you've never watched the show, do yourself a favor and tune in. As you can see, Maura is asking, what exactly is required of me? And by now, I'm sure you're wondering what the heck we're going to be doing today. Well, here are our objectives for the day. So by the end of this training, my hope is that you'll be able to define health literacy, understand the benefits of helping to increase folks' health literacy. I want you to be able to recognize the signs of limited health literacy and identify some strategies that you or your agency can actually implement. Now, by the end of this training, if you don't get it, and keep it to yourself. I'm just kidding. It's my hope that you will learn something today that you didn't know before. And as I said, if you need a learning moment or if you don't understand something, please say something. The first objective is understanding the definition. I'm real straightforward, so I'm giving you that jump immediately. Now let's jump in. So you'll see two definitions on the screen. There's personal and organizational health literacy. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And organizational health literacy is the same thing, but with organizations being equitably enabling individuals to find, understand, and use that information as well. So these definitions are from CDC's Healthy People 2030, and having two definitions differs from Healthy People 2010 and 2020. The new definitions emphasize people's ability to actually use health information rather than just understanding it. It focuses on like the ability to make well-informed decisions instead of just appropriate decisions. It also acknowledges that organizations certainly do have a responsibility to address health literacy. So you're probably asking yourself, why should I be concerned about health literacy? What does this mean for my clients, my coworkers, my friends, my family, myself? It's actually estimated that 30% of America's population experiences limited health literacy. And for folks like me who don't like percentages, be like, what does that mean? That equates to about 89 million people. So this isn't sequestered by a geographical area. So think about it. That's a lot of people. So I'm sure we know someone within that number, and at any given moment, we could be within that number. And on the flip side of this, only about 12% of folks are proficient in health literacy. And in other words, more than 1/3 of the adult English speaking Americans are at a basic or below basic health literacy skills. And if we put that in terms of the Memphis Transitional Grant Area, that's about 761,000 people. So only 1/3 of clients with limited health literacy were able to answer correctly what it means take 2 tablets twice daily. And only 42% could understand take on an empty stomach and 60% didn't understand informed consent. So we definitely want to be aware of our health literacy, the health literacy of our clients, our patients, and even when we're just explaining anything related to health information to anyone. It could be our friends, family, or whoever. So here's another reason to your why should I care. So we're looking at our 2019 numbers in the Memphis TGA. We always do a good job for diagnosing folks, but what happens after that? From my experience, many folks don't always catch what we're pitching sometimes as providers. Out of our hearts, we sometimes can give an overload to folks with information, and we have to realize that limited health literacy isn't the only factor contributing to our numbers, but it could actually be a large factor from where we miss people from being reaching viral suppression. So when we're thinking about explaining things like viral suppression or what it is to be engaged in care, these are also times when we think about how people's health literacy skills could be impacted by what we're actually saying. So we can always find ways for better client engagement and promoting health literacy. It's just one of those tools in our tool belt to ultimately help us in the HIV epidemic. So now we're going to take a couple of minutes to see what it might be like for someone that might be experiencing limited health literacy. Now, I'm going to give you about a minute and 30 seconds to read this slide. You don't have to read it out loud. I just want you to read the passage as best as you can. Now, this is experiencing from people with limited health literacy. Now, if it's a little difficult for you, don't fret. Be difficult for anyone to read something like this. Take just a few more seconds. Can't get through it. Type it in the chat. You're like, what the flip, Eddie? I don't know what this is. You can type that in the chat too. Okay, so Morris said it best. That was a quandary, baby. Now, did anybody finish the yes, Elizabeth? Did anybody finish the actual passage? If you can tell me what it said, tell me what was most difficult about it, and what would you do if this was how you saw medical instructions? So you can answer any of those questions. If you finished, if you know what the message said, what was difficult about it, or what would you do if this was how you saw medical instructions? Absolutely, yes, you're both right. It was something about cleaning. And just as a little heads up, the words were just backwards. It wasn't any new language. The words were just backwards. Oh, yes, Janine. That is definitely how a lot of people see medical instructions. I just got my teeth cut out probably maybe 2 weeks ago, and that's literally what I saw in those instructions. Ooh, thank you for engaging in the chat. Now, here's the actual passage. It is about cleaning, and it just goes in to say how you clean using a cotton swab with isopropyl alcohol. So it's nothing really extravagant. It's just giving you an example of how folks can get the message or how it feels to get the message when you have limited health literacy. So many people feel rushed when they're with us because we seem busy. And on the other hand, people may also be busy rushing through our appointment with us. So there are so many things that can impact our ability to be more proficient in our health literacy. So thank you for engaging in that. So health literacy is critical when we think about the ever so complicated healthcare system. We should always remember that anyone can experience health literacy at some point in their life. Now, there are some populations and communities that may be more vulnerable to limited health literacy. This includes our aging population because we're living longer and we're actually experiencing more health complications by living longer. Also included in those populations are communities of color, folks with lower incomes, and people who speak limited English. So health literacy is truly dynamic. It can change from moment to moment based on the demands placed on a person at that time. Health literacy is affected by a person's environment as well as their emotional, mental, and physical state at the time they're being asked to understand any health information. So let's think about it. A stress filled, a heightened emotional state, or physical pain can impact a person's health literacy. So as I mentioned, when I got my instructions after my surgery, I couldn't understand anything that they were talking about. Luckily, they have you with someone, but it's really important to know that at any given moment, any of us can experience that. So think about a time when you were stressed or you were scared, or even a time when you've been super exuberantly happy. During those moments, you don't always feel at your peak ability to take in or understand new health information. So think about that when you're also thinking about your clients. So low health literacy impacts all aspects of care. That's your access, your safety, your quality, and your outcomes. So with access, healthcare information is oftentimes difficult to find. You don't know where to look, and if you understand websites, how do you know which one to use? And are you even able to use the computer? So healthcare services and institutions are also complex and confusing. So you think about, where do you go to find the care that you need? There's so many options today. Like, you have your nurse lines, we have urgent cares, you got e-visits, you can email your doctor, call your doctor, go to like a mini clinic. There's so many different ways that you can be engaged in it. So you have to identify the right one for you. So then you ask yourself, how do I know when to seek out, or why do I need that preventive care? What about the navigation? Where do I go once I get there? Are the maps clear? Are the signs on the building clear? And what about the bus schedules? Do I even understand the bus schedule? Now, when we think about safety, patients with low health literacy may not be able to clearly talk about their conditions or even their medications. This can be dangerous if the patient actually gives like an inaccurate self-report. So informed consents are also written less for the patient and more for legal issues. So there should be more discussion on the things that we talk about with our patients. So when we cover the forms, we can ensure that they understand what they are consenting to. They may be nervous when talking with us and not speak up about some of the things that they don't understand or that they may fear. When we think about quality, patient satisfaction is an important measure these days, and people who have trouble understanding the instructions from their doctor, they often report lower satisfaction with the doctor or the facility that they're receiving their treatment. So health professionals also need to pay attention to our cultural and linguistic needs for each of our clients. And lastly, we have outcomes. Low health literacy impacts the understanding of medication labels and treatment regimens. Overall, treatment adherence problems typically come up when patients don't understand the importance of maintaining a treatment course or follow-up appointments. Now, as you can see, being health literacy involves many skills: reading, writing, math, sometimes comprehension, and even complex reading, map navigation, advocating for oneself, and even more. So all of these things can be impacted by limited health literacy. So why? Why is there a threat? Why are folks at risk? We actually rely heavily on written word for health communication. Patients are handed information as they leave the doctor's office. We mail out insurance information, and waiting rooms are normally filled with brochures, magazines, and anything that you can get your hands on. So health information is typically communicated at a very high level, normally around the 12th grade or higher amount. But the average American typically reads at around an 8th grade level. So this creates a large gap in folks' ability to actually understand the health messages that we're sending. And we all know the healthcare system ain't getting any easier. So there are more medications, there are more tests, there's more procedures, and clients are given more options and expected to be able to choose the best one for them, even when they are experiencing limited health literacy. They're expected to do more on their own, to be able to take care of things at home, their self-care requirements, and things like replacing measures, gauze, and all of that. So in terms of patient education, like 35 or 40 years ago, a new diabetic patient would have been hospitalized for about 3 weeks or more. And they would have received about 2 hours of patient education a day. So by the time they were discharged, they would have gotten about 15 classes or 30 hours of instruction before leaving the hospital. Now, new diabetics are treated as outpatients with limited instructions before returning home. So when we have our written documents, it is critical that we actually take an intentional approach, an intentional health literate approach to drafting and getting these communication moments. So when I think of self-care, I often think of when I've tried to go out and look up a symptom or a disease on the internet. So when we are thinking about our self-care, not in the terms of, being happy, we're thinking about caring for ourselves. The worst place people say is to go to Google. And I will tell you, it is already a challenging place where you already have to have health literacy, you already have to have literacy skills. Not only that, but now you have to be more health literate to correctly navigate yourself to a reputable page, something that contains the information that is actually helpful for you. So we as consumers typically are directed to look at our website, and it might be no surprise that we hear all of these resources at our fingertips, and they're right there where we want them. But those at the lowest health literacy levels never use the internet to get their health information. So it's always important for us to be able to share that. So we often use like an esoteric language in healthcare, and esoteric is a word that we should not be using with folks. What does it mean? It means mysterious. So that's confined to and understand it by only an enlightened inner circle. So when we are using our jargon, when we are using our words that are above a certain grade level, the words come off as mysterious and esoteric to folks. So think about that as well. So we know that limited health literacy has an effect on our clients, and most of those effects result in poor health outcomes. Some of those effects include clients may not be able to describe the basics of their condition. Folks may have limited knowledge of what preventive measures that they can take in order to stay healthy. And people may also take their medication incorrectly because they didn't understand the instructions or they were unable to read the labels on the bottle. And consequently, this could lead to a decrease in medication adherence for the client. So let's talk about some of the benefits for promoting proficiency in health literacy. We could see an increase in use of those preventive healthcare measures. There could also be a lowered amount of emergency room visits and stays in the hospital. We'll see less errors in people taking their medication and helping clients to better manage their conditions. And rounding out our benefits are improved healthcare outcomes and increased client satisfaction. So now we know the effects, the threats, and the benefits. Let's talk about some of the indicators for identifying signs. People with limited health literacy may take their medications incorrectly because they don't understand how to take them. Medication instructions can be complex and often use idioms or unfamiliar words for folks. For example, people are often described or instructed to take their medications orally rather than by mouth. Expressions such as on an empty stomach may be confusing because they are imprecise. A better way to express on an empty stomach would be take your medications 3 hours after you last ate or before you ate. And we know that folks typically have excuses for why they can't do something or why they actually have a negative behavior. They also infrequently have questions when it comes down to their conditions. They often miss their appointments or their tests, especially when we ask them to come in and maybe they don't understand a certain thing of us saying, come in 3 Thursdays from today or come in the 3rd Thursday. Those instructions can be a little difficult for folks. We also see people with limited health literacy not completing their intake forms, and they may not be able to describe their medical history or the actual medications that they're taking. The forms may be too complex, or the client may not be able to read them. And folks with limited health literacy may also have a hard time remembering the instructions that they had just read. So it's important, and we'll go over a few techniques to kind of help with folks being able to understand their conditions, being able to actually help with forms, things that we can do. So we'll take a little dive into that deeper. So we know that no indicator is absolute, but let's take a look at some of the indicators for folks with HIV. So people with HIV that have limited health literacy might have a viral load that is consistently high. They may not be able to explain the basics of HIV. We've also seen frequent hospitalizations and skip preventive measures. We also know that people with limited health literacy may experience multiple health conditions. The take home message here is that these indicators are simply to provide prompts or cues that a client may be experiencing limited health literacy. Like I said before, none of these are absolute, but they can help us recognize when limited health literacy may be an issue so that we can ensure that our clients get the information that they need to be active and to be an engaged member of their healthcare team. Now we've addressed the problems, the signs, the definitions. Now let's get into some strategies, some work that we can do. But before we do that, I want to take a moment just to take questions. I said a lot, gave a lot of information, but what questions do you have for me before we jump into strategies? I'm trying to extend my chat box. There we go. Okay, we're gonna keep moving. I will periodically check the chat box. So if you do have questions, chat them in for me. Oh, there's Mora. I was like, why is Mora not moving? So first up, we're going to talk about strategy for personal health literacy. So it's important to think about biases when we're talking about strategies to promote personal health literacy. And bias is defined as a prejudice in favor of or against one thing, person, or group compared with another, which is usually in a way considered to be unfair. Now we know there are two types of biases: conscious or explicit bias, and unconscious or implicit bias. Conscious or explicit bias means that you're aware of it. You could actually say what it is. An example of the conscious bias would be like, I don't like working with complainers, or it takes too long to work with someone who needs an interpreter. Those things are biases to a certain population. So when we are speaking those things, we're saying them out loud. Now, unconscious or implicit bias is a type of bias where we're not aware of it, where we may even deny it. And in the healthcare field, some of the things that we may say, we know how to work with our clients. Health disparities don't happen at our organization, or we don't experience things such as stigma or like that. We've also heard that providers might prescribe medications like pain meds less frequently to people of a certain race or ethnicity or identity. And the provider actually might think that they're making individual judgments about the trustworthiness or the irresponsibleness of the patient. But when we step back, we actually see that it's a systems problem with that. So that further explains our biases, where it cannot solely rest on us as individuals. There may be system problems. Now, it's important for us as providers to recognize that everyone has implicit biases. There are things that we can do to reduce them and lessen their impact. Sometimes what we can do is normally increase our exposure to the things that we may not be aware of, and actually will help us to counter the stereotype. And trying to be positive during those encounters with like diverse patients, increasing your emotional regulation, building trust with folks, asking questions of people, when they are speaking, talking to them about whatever it is that you may have. Now, you may have a trusted person that you go to, because you have to know that everyone is not as willing to give those learning moments. So you kind of know when to express that interest in that person and when not to. So experts recommend that everybody may have a difficulty understanding and creating an environment where all of our patients can thrive. I said before that only 12% of the adults in the United States have health literacy skills, but they still need to be managed, and the demands on our complex healthcare system also need to be managed. So normally we hear about universal precautions. We think about healthcare system, people wearing gloves, and all of the things that we do in the actions part of it. But universal precautions has a bigger impact when we think about health literacy, because we never want to stigmatize a certain person or a certain population because they are experiencing limited health literacy. Because like I said before, all of us can experience limited health literacy in any moment. We could get stopped by the police, and then we may not be thinking straight because we're worried about the ticket, or we're worried about, did I leave the stove on? All of these things can impact that. So I thought it would be helpful for us to look at this graphic. It's the personal pyramid, which describes a lot of our characteristics. So if you look at the top, we have the visible characteristics that we can typically see. But remember that these images do not wholly represent who that person is. And then if we think about it, we can't always tell by looking at someone. So our second tier is our less visible characteristics. So these are things like our political views, maybe our gender identity, our religious practices, or even our talents. And at the bottom of the pyramid are often our hidden characteristics. These are things like our early life experiences, our thought patterns, where we're born, or even our history with discrimination. So this take-home message for the graphic is to dive a little deeper into not only our clients but ourselves. So ask questions that we really need to know in order to better assist that client. So sometimes our beliefs about a certain thing may be hidden and we don't speak up. But if we're genuinely engaging with our clients, then we can offer the best solutions. So checking in with our face-to-face communication is also another strategy to promote health literacy among our clients. By communicating in a way that the client understands, we can actually help them to understand their HIV, their treatment, and the healthcare system overall to help optimize healthcare outcomes. First up is creating a shame-free experience. Of course, with trauma-informed care, we want our clients to feel safe when they're with us. By creating this space free of shame, we offer a safe space for clients to be their entire whole selves and offer them space to ask questions when it's sometimes difficult to speak up. Again, we want to use plain, non-medical language that the clients can easily understand. And when we have to use that medical language, maybe explaining it a little bit further or deeper on a lower level where you would want it to be explained to yourself. So it can be complex to talk about anything. And we have to remember that clients probably won't understand many of the terms that we use. So whenever it's possible, use that non-medical language. And remember to repeat your main points more than once. It may take maybe during the conversation, and then at the end of the conversation, you may want to repeat those main points more than once. Always ask open-ended questions for their clients, so that way the client can answer in a way that's more than yes or no. We also want to listen to understand the needs of our clients. It's really important to pay attention to what the client is saying verbally and even non-verbally. Most times we hear the client, but it's critical to actively listen, because most times the clients may express a need for A, and it may be M that they actually need. So there may be a wide array of needs that the client may not be asking. And if you pay close enough attention, then you'll be able to use some of the words or the expressions that your client uses. Now, I put when appropriate because not everybody should be running around talking like a city girl, and we don't want to be offensive if we don't know the full context of the actual expression. And we also want to be super, super, super specific with our instructions. Rather than saying take your dose twice daily, make sure that you define what that dose is. You may even say every day, take 2 pills when you wake up and 2 pills when you go to bed. Now you'll notice that I didn't say in the morning or in the evening. And this is because it's important that your instructions make sense for that client's life. If that client works late at night or they work overnight shift, it might not be well to say in the morning or in the evening. So listen to and learn from your clients. So that way you can give them the best information in a way that works for them, in a way that they're comfortable with and able to actually implement the information that they receive. And another strategy for face-to-face communication is to decrease the amount of barriers between you. Now, most of us have heard this 100 times before. So when you do have a safe space, it's important to minimize the barriers, whether that's a desk or, maybe a large table. Maybe you don't want to go into like the conference room to speak to your client. And if you have to, sit next to them so that way you're not across the table. That also goes against the balance of authority, because we want clients to feel that they are a part of the healthcare team and not that we are an authoritarian telling them what they have to do. And lastly, smile when it's important and genuine, appropriate and actually genuine, not important, when it's appropriate and genuine. So there are plenty of times where you shouldn't be smiling, but we have enough emotional intelligence where it should kick in and hopefully help us with this one. Everybody loves a smiler, and if you're not a smiler, maybe a little grin, something will help. So plenty of us have probably heard of these as well. So here's some strategies that we can use for client engagement. Now, if you've heard of Ask Me 3, Teach Back, or the Show Me approach, you can type in the chat. I've heard this before because I may want you to answer some of the questions that I have. So has anybody heard of the Ask Me 3, the Teach Back method, or the Show Me approach? And some of y'all should have, because I did a training maybe a couple of years ago about these things. You can say no if you haven't. No, Ask Me 3. Okay. Jennifer, you're going to get a good little lesson today. Let's see. So for Ask Me 3, the approach was developed by the Partnership for Clear Health Communication to kind of improve our two-way communication. It helps the client to be more engaged and actually help them understand 3 essential questions to each of their visits. There we go. So the questions that we normally ask for ourselves is, what is my main problem? So we want to answer that question for the client when we're discussing things for them. What do I need to do? We want to make sure when we're giving instructions, we're telling the client what it is that they need to do and why is it important that I do this. So we want to make sure that the client understands the importance of what it is that we actually tell people. So the Ask Me 3 helps you filter out the information that may be nice to know, but isn't necessary to know. So that way the client can focus on what's important. Now with the Teach Back method, it's a valuable tool to use with every client. It can improve their ability to adhere to their medication. It can help them reduce the amount of times that they call to the health center or to our clinic or to our office for clarification. It can also reduce the amount of times that clients cancel their appointments, because we actually want to make sure that folks at every level understand the Teach Back method. So the Teach Back method helps you know if you explain information well. It is not a test of the client's knowledge. Instead, it's a 3-step process through which we learn how to improve our communication with our client. So you want to first explain the information to the client or specify an action that they need to take. Check the client's understanding by asking them to restate the information back in their own words. And then you want to listen to the client's explanation and clarify or re-explain the information if necessary. So some of the prompts that you can use in the teach back method are, in your own words, tell me, what does it mean to have a suppressed viral load? Or explain to me what medications you take when you wake up. These questions can be very helpful when thinking about the teach back method. And in the case of the teach back method, it's important that they don't feel like they're being tested. So the show me approach actually confirms how well we demonstrated or communicated our skill or action. So one of the biggest challenges for the teach back is to the requirement that we use open-ended questions rather than closed-ended questions. Anything that begins with can or do, such as can you explain why you take this medication, or do you have any questions, can always be answered with yes or no. But neither of these replies confirms understanding because the clients don't always demonstrate their knowledge. So by acknowledging that the purpose of the teach back is to ensure that you explain things well, and not their ability to understand, so we can actually use phrases like, we covered a lot, and I may have gone through the information too quickly. What questions do you have for me? Remember to use your plain language and self-correct if you begin to use a lot of jargon. And it's our responsibility to ensure that our clients understand our explanations, our instructions, and our guidances are clear. So also note that you can use the teach back in any language and the show me approach in any language. So one thing that you may do with the show me approach is show me how you fill your pill box, or show me what pills you take when you wake up. So these are some of the questions that you can ask when you say show me. So some of the tips for the teach back method, as I said, is to use those open-ended questions, include the family members or caregivers of people, document the use of and the client's response to your teach back and show me approach. And as I said before, self-correct yourself if at any time you make any mistakes or at any moment you speak in a language that may not be familiar to that client. It's okay to self-correct yourself. So, communication encompasses more than just face to face communication. We also communicate with clients through many forms, through many formats. So, what are some of the communications, written communications, that you send out or that you give to your clients? What is it that you give your clients that may be written? What are some of the things that you give out? Another question for the group. I already mentioned brochures. What it said that? What else are some of the things that we give to our clients? I was trying to be present. I was going to ask some questions. Maybe not a quiz. Be some questions. So think about the healthcare materials. We give appointment cards. Sometimes we may give a little card for when they have to come back for their appointment. Maybe a summary of their visit. Maybe another thing. And even, yes, informational resources, whether that's like a referral or something that we may give to people. That's also another thing that we do that's written. So, yes, cool. Thank you for that, Elizabeth. So, when considering your written communication efforts, you should actually consider your formatting. Is it visually appealing? The layout should also create a clear and obvious path for the eye to follow, and your information should have a consistent style and structure. It's important that the font be common and easy to read, such as the Times New Roman or Arial or Calibri. One of those are actually more commonly used. And also make sure that the size is easy to read, which is usually a 12-point font or larger. It may be necessary to provide an alternative format to clients who have a visual impairment. You also want to left justify your text so that the left side of the text lines up like a ruler and the right edge is the jagged side where it doesn't line up. So make sure there's sufficient white space around the text and that your margins are at least 1 inch. Now, formatting is certainly important, but of course, it's also important to write clearly and effectively. Use those simple, short sentences for your health materials, and whenever it's possible, your words should not be above 1 or 2 syllables whenever that's possible. Now, it can be hard to keep those medical terms short, I know. So, if the big words are needed, make sure they're clearly explained. Your sentences should only be about 10 or 15 words. Paragraphs should only be about 2 to 3 sentences each. Now use strong and vivid words and phrases that are culturally appropriate and familiar to your audience. And as a general rule, your print material shouldn't be written above a 6th grade reading level. So even though it's important that we use our complicated or big words like antiretroviral or viral load, we can and you should use plain language to explain what they mean. And you'll also see a living room example. So living room vocabulary is what they call it. So doing so will help your clients actually build their health literacy and help them to better understand their health. So even patients with high proficiency or even a higher health literacy prefer to read health information that's clear and easy to understand. Now, when we talk about written materials, we're talking about materials written for clients. We aren't talking about patient medical records, referral forms, or other legal documents. So the content of our written materials should focus on the experience of a health condition rather than what's happening in the body to create the condition. So if we give clients too much information and use our long, complicated words, we can make it hard to understand the material. So we need to have information that's informative, like information that's informative, of course, and action oriented. It should tell the client what they need to know and what they need to do and why they need to do it. This is important if the material talks about a high risk situation, such as like a medication change or a change even in your location. These things should be addressed like majorly. And the material should clearly describe any warning signs or side effects that the client should look out for and what to do if they do have a problem. The material should also be placed in to add information about who the client should contact if they have any questions or if they have any concerns or even if they have a grievance about something that they have experienced. Okay, so we talked about personal strategies. We're going to move on to organizational, but I want to do a check. Does anybody have any questions? I see your hearts and loves. Thank you. Yes, is it a language that they can read? We always express to people to take a needs assessment of your community because sometimes it may not be Spanish or it may be an interpreter that speaks a different language outside of that. But in the Mid-South, I think we're doing better. We're doing better with our language skills. I will say that. Okay. So next up, we're going to talk about some organizational health literacy. These are strategies that you can actually take place in your agency. So let's start off with building trust. Trustworthiness is one of my most cherished principles of trauma-informed care, especially because I said I love working in the community. So organizations have to do their part to ensure that folks who use their services actually trust them. In order to be a trusted community partner, your agency must be attentive and responsive to the needs of our clients while also being respectful to their individual experiences and perspectives. It's important to note that the client's needs and their experiences and perspectives directly shape and influence the way that they see the world, which influences their culture. Now, organizational culture is a set of shared assumptions that guide what happens in organizations by defining the appropriate behavior for various situations. So people within an organization usually share assumptions that influence how they understand those different cultures. And organizational culture typically stems from the practices of the members of their organization. Leaders, our leadership, they play an important role in the development of that culture. So over time, the behaviors, the characteristics are typically what shape us into that place, and it's passed on to new employees when they come in. So the culture is consistently making a full circle a moment. So thus, it's important that leadership actually reflect the type of organization that it wants to be. Now, in the chat, I want you to think of a time where a leader actually impacted the culture of an organization. And I want you to type it in the chat. Let's think about some positive things. What are some positive things that a leader has actually done in your organization to impact the culture? Or practices. It could be a practice. What have they done? What have they said? Where have they gone? And even some negative ones. We can think about some negatives, but we're going to end on a positive note. What about gossip? Gossip has been a big thing that folks have come through. So folks may have experienced gossip from their leadership. Creating a new path, making your own stamp, having your own identity. Yes, leaders absolutely help shape that as well. What are some other things? Maybe even taking the first, oh no, I can't say that. Taking the first step when it comes to a new initiative there may be. Maybe it's late hours in the day. You have later hours in the day. So maybe the leader stepped up to do a longer work shift. So these are some of the things that can be affected by our leaders. So thank you again, Elizabeth. So one of the major strategies to promote organizational health literacy is for an agency to work towards becoming a health literate organization. So in the slides, I linked to this discussion paper and a few others that will describe in detail ways that an agency can actually accomplish the task of becoming a health literate organization. So here's a graphic that shows a high level approach to becoming what it is to mean to be a health literate organization. And if you look closely, the bricks of the foundation are 10 attributes of a health literate organization. These attributes are critical to the structure of the organization, as you can see in the framework of it. Things like including consumers, explaining coverage and costs, and even preparing the workforce are all important factors of becoming a health literate organization. So we're going to quickly jump through the health literate organizations, but as I mentioned, you can absolutely check the resource slide for a more in-depth approach to how we can become a health literate organization. So number one, the organization has leadership that makes health literacy integral to its mission, its structure, and operations. Number two, it integrates health literacy into planning, evaluation measures, patient safety, and quality improvement. Now, make sure you have that in your head that it integrates health literacy. So it's actually ingrained in your planning, evaluation, your safety concerns, and your quality improvement. Next up is preparing the workforce to be health literate and monitor that progress. So whether that's providing training for folks to learn what health literacy is, to how to implement health literacy, and then monitoring that progress is actually what will give us an idea of what success looks like, right? So we have to recognize that everybody needs their health literacy training. And as I mentioned before, it goes from the top all the way across. So whether that's your leaders, your actual providers who are delivering the service, your front desk staff, your environmental services. All of these people should be engaged in your health literacy trainings. And number 4, they also include populations served in the design, implementation, and evaluation of health information and services. Now, this one is self-explanatory, and we can't be for the community without actively involving the community that we serve. Hire folks, engage folks, and compensate folks. And number 5, the organization meets the needs of populations with a range of health literacy skills while avoiding stigmatization. So we talked about a universal precautions approach earlier, and it's important to remember that we can't visually tell who's experiencing limited health literacy. And sometimes people are good at faking the funk. They might say they understand, but can't relay the information back to you. So remember, universal precautions. Number 6, a health literate organization uses health literacy strategies in interpersonal communications that confirms an understanding at all points. So think about your spoken communication, your written communication, the show me approach, the ask me 3, the teach back method. So think about these things when we're delivering our communication. Number 7, a health literate organization provides easy access to health literate information and services and navigation assistance. So they also make it easy to find and understand that information, find a way to and around the facilities, and move among healthcare and community providers. So we're thinking about that. We're thinking about our signs. We're thinking about the the instructions of how to get where to go in your next step of your care. So think about that when you're promoting your communication, or not promoting, delivering your communication. Number 8, organizations design and distribute print, audiovisual, and social media content that's easy to understand and act on. So you want to establish a process to ensure that all of the information that you send out, not just your educational materials, is clear and effective for your audience, both in terms of health literacy and in language. Number 9, health literate organization addresses health literacy in high-risk situations, including care transitions and communications about medicines. High-risk decisions, situations, and transition demand more attention to health literacy. And these organizations that are health literate identify which situations are express those heightened safeguards and have those standards and processes in place. That way you ensure that there's no miscommunication. And lastly, health literate organizations communicate clearly what health plans cover and what individuals will have to pay for services. So before making any healthcare decisions, consumers need the information about their out-of-pocket costs. Health literate healthcare organizations inform the consumers about the cost of their care in advance and refer people to programs that can help make the care affordable. So a lot of times we think about Ryan White, we think about Hopper, we think about all of these other systems that are in place. So think about those systems when we're becoming a health literate organization. Now that was 10 health literate attributes of a health literate organization. Remember, there are more in-depth strategies that you can take once you look at the resources that I gave you. So, settle out there. Here's some potential activities that you can actually take place. I would love it if you could apply any of these techniques that are applicable to your work or to your agency's work. You can also review your documents and even social media posts for a more focused approach on health literacy. Use terms that are easy to understand. Use simple forms that are easy to complete. Think about your telephone system. Is it patient friendly, or is it a lot of times we got to press 3 or 4 numbers to get to you? And even providing clear directions for taking medications. So you can also develop a plan to address limited health literacy. I also link the resource so that you can assess your agency as well. And then what I would love for you to do is to share with your colleagues. So we're all better because of the information that someone shared with us. Pay it forward. Now, that is something that I'm super, super, super eager to know for folks is how you will share the information, because not only will you share it with your colleagues, you'll share it with your leaders, you'll share things with your family, your friends who are also in similar fields as well. So think about all of those steps. Now, here's some resources. As I mentioned, you can find the attributes of the health literate organization, how to assess health literacy in your organization. There's also a preferred terms that CDC put out for special populations and communities. And there's also a few other resources that'll be helpful to kind of help you implement those things on your health literacy journey. I'd like to extend a huge thank you for those of you who stayed with me today. I know I did a lot of talking, but I truly hope you did get something today. You can find me here. My email address is there. Also, the website. And that's all that I have right now. I'll take questions from you all. Feel free to raise your hand. Can you raise your hand in WebEx? I think so. Chat them in, raise your hand, come off of mute. This is time to ask whatever questions you may have.
Well, yes, I'm Elizabeth. It's one thing that I really like when you sharing your information and you have maybe another worker come in, and that person may be private, and don't want to share the information with another person, and all of a sudden they get to know my information, but I never seen them. So you did made a good point about you know choices about sharing information, getting things organized. Technology is more for us, and you got to be on hold. You got to go 1, 2, 3, or like then you have a help person answer the phone. I said, well, I really didn't ask one of you. I was a social worker. Then not knowing who you got to get your information to because someone's no longer there, and you got to get your vital loads into them to be compressed for you even have a home and things like that, but you can't get those information. Then it lead that person to be stressed out. So that's when you have to find somebody to explain why that person now and you got this new person. So I think there should be a lot done. But you need some topics. I just want to know, could I get your slides, like the slides that you just want to know when you
Yeah,
email
absolutely.
it?
You'll be
I
able
would
to
like to
get the
look.
slides. I'll send, Elizabeth has the entire presentation. So that way you'll have the resources and everything else that you'll need as well.
All right. Well, thank you. But that's all I wanted to share.
Oh, thank you for sharing, Elizabeth.
All right.
Thanks, Mary.
As Eddie did mention, I will be sharing the presentation with you all, as well as those who may have not been able to join our meeting or training. But the other piece is, as he mentioned, or not he mentioned, but we also sent out the recording for this training as well. Just giving everybody an extra moment. If you did have any questions, please feel free to come off mute or come on camera if you want to say hi. Anything is welcome.
Good morning, everybody. I'll say it's 12, so I'll say good afternoon, everybody. My name is Dominic. I am with CPAC. We are a nonprofit serving the newest community, connecting our vulnerable populations with health insurance at no cost to them. Just wanted to, I don't have any questions, but I wanted to say thank you so much for the wonderful presentation today. It was very well put together. We normally always intend to plan to attend these meetings as they are a great source of information to help us better serve our populations of the Memphis community. So we're appreciative. Just want to pop in and say good afternoon and thank you all.
Dominic.
Thank you. Dominique.
All right. Well, I'm not gonna hold everybody. If you don't have any questions, like as I mentioned, we will be sending out the recording as well as the presentation. And with that being said, thank you for being here, and I will give you about, what was that, 20 minutes of your life back. Thank you.
All righty. Thank
Also,
you.
quick question.